There's an everyday kind of trauma that we all have experienced. From Epstein's perspective, trauma is not something that is sort of outside of the frame of normal experience. It's not something that warrants a kind of special attention as something abnormal or strange. He sees trauma as just an essential and inevitable component of living. I'm Glenn Wood.
And I'm Richard Tadamir.
We're psychotherapists based out of British Columbia, Canada, and you're listening to Deliberating Practice.
In this podcast, we deconstruct everything from the foundations of therapy to its newest innovations and horizons.
We take a critical perspective on contemporary issues that affect therapists across the world. We share our own stories, both personal and professional, and sometimes we talk to other therapists too.
We hope that this podcast can be like sitting with the trusted mentor you always wish you had, helping you integrate and make sense of our complex and exciting field.
So sit back, relax, and enjoy the episode. For resources, show notes, and to work with Richard or Glenn for supervision, consulting, or counseling, go to deliberatingpractice.com. Good evening, everyone. Welcome to the Deliberating Practice Podcast. I'm Glenn Wood, your host, joined as always by Richard Tadamir, your other host. Hi there, Richard. Nice to talk to you tonight.
Nice as always.
Yeah, good to see you. How have you been?
Been doing well, and looking forward to, as weird as that sounds, is to processing, I guess, some trauma with you today.
Yeah. I love when you sort of open by saying we're opening up to some trauma tonight. I can't exactly remember what you said.
Yeah.
There was so much vulnerability in that right away, and I was like, oof.
You're like, nope, let's go back to sleep.
Yeah. But it was a nice cut right to the heart of it, right? The sort of the nature of trauma in some ways. And, makes a fun segue to the topic of our episode tonight, which is to talk about trauma. Tonight's episode is a little bit different. It's maybe not a conventional episode on the topic of trauma. We're not really approaching this as though we're sort of experts in trauma and kind of introducing, what trauma is, what trauma counseling or trauma psychotherapy would be, but more just like kind of visiting the space of trauma, kind of asking the question, what is trauma in a deconstructive sense? And then trying to explore the space of trauma, explore the horizons of trauma. What do contemporary perspectives in trauma offer and afford? What might they constrain? What are some different horizontal opportunities for the space of trauma that we could situate our work in?
And what's missing in this discussion about trauma, I think we definitely wanted to talk about. Yeah.
There was a way we talked about introducing this topic during the prep, which is to sort of talk about it as, is trauma solved? Like, when we think about trauma as a topic in psychology, sort of as a problem that people experience, we can ask that question, like, is this something that's really solved and figured out? Like, is there a sufficient understanding around the space of trauma that we can work effectively with it? I think the solved kind of goes a little bit further, though. It's sort of like it's a non-problem, like kind of our technology is such that we wouldn't be subject to trauma anymore.
Or that if it did occur, it just could be resolved so quickly.
Yeah. That it wouldn't be a problem. And I think partly why what got me leaning into this trauma episode was just seeing, discussions on Reddit from therapists, sort of expressing competency and confidence around treating trauma, and sort of the massive proliferation of integrative trauma treatment protocols and trauma treatment approaches that are out there now. You get the sense in some ways that trauma is figured out, right? EMDR, IFS, somatics, just sort of whip those together in a bowl and you have a trauma treatment. I'm not going to be unduly critical of these approaches and the things that they afford in the space of treating trauma or any other problem, but we're sort of just visiting the issue of trauma from that perspective. What remains to be done or remains to be figured out in the space of trauma? Have we really come to a place where trauma is figured out and there's nothing new to approach in the space of trauma?
I think about it in a sense that, because we know that a lot of people have
trauma, and we know that, and I'll Reddit, what we could talk for hours on Reddit, but this sense of, okay, well, if you just follow ABC and, therapists, then you will be able to help this client with the trauma. Have you tried DBT? Have you tried this or that? And so it's what I see on Reddit, at least in some of the threads, is kind of like, oh, well, you're just not competent enough. You don't have enough treatment fidelity. And that's why, your client is still traumatized. I've seen quite kind of blame the therapist trends on there. So I don't think it's as simple as that. I think there's so many factors, and we want to explore some of the factors, turn over some of those stones that maybe are not always talked about so much.
Yeah, for sure. My mind is immediately sort of drawn to the history of trauma too, and sort of just as an interesting sort of contextual piece around our discussion of trauma. I'm just thinking, actually, maybe, Richard, before we go much further, we should just kind of define trauma a little bit for our listeners, just to situate some kind of definition around this word that we're probably going to say a lot tonight.
Yes. Oh my God, yeah.
So do you want to take a stab at defining trauma, and then I can take a stab at
Sure.
defining trauma?
Yeah. And I feel like as we've talked about this, and maybe even over the course of this episode or forming this episode, my ideas have already changed. But, and reading Kalsched's book, Donald Kalsched, Trauma and the Soul, and some other works we'll be talking about. But at this point, the definition, I guess, I have been taught, or one definition, is trauma is something that overwhelms an organism's ability to cope. So it overloads their, existing coping resources, whether that's social resources, people to reach out to, certain skills, certain supports. It overwhelms that, and it then leaves the person in kind of an immobilized and stuck state. I think that's a very, in some ways, a neuropsychological kind of strongly probably brain-based, and that was where a lot of my training has come from, and I still think there's some merit in it. You and I think some of the authors here have really challenged that belief that there's a lot more to understanding trauma than purely a materialist view. So what about you? I'd love to hear what you've thought about it.
Sure. I just want to comment on what you said, though, Richard, because I didn't hear anything neurobiological in what you said. I think you spoke.
I think I was thinking it. I was thinking, okay, and the nervous system,
sure, and brains,
fight, flight, freeze, sympathetic, right? So my frame of reference is still coming from there. It's hard to change an old dog from his ways.
No, fair enough. I mean that's how the concept was introduced to me initially too, and it makes sense, and it's common, it's endemic. I really like your definition. I don't think I could really add much more. I would just make reference to how Donald Kalsched, the author of two of the books that we're looking at tonight as part of our episode, The Inner World of Trauma and Trauma and the Soul. Donald Kalsched is a Jungian psychoanalyst and has written fairly extensively on trauma from a psychoanalytic perspective, kind of has brought a somewhat novel position around understanding trauma and treating trauma within an analytic context. So pretty exciting work. But his definition of trauma, which I really like, is just anything that can't be consciously bared. So he really does situate it kind of psychologically in the context of the psyche. And for him, anything that can't be sort of consciously held, integrated, metabolized, or sort of thought about in the moment that it's experienced is traumatic in some ways, and necessitates some kind of psychological defense in order to endure it. So that would be his definition of trauma. So, maybe we work with that. We're talking about something overwhelming, something we can't bear, some type of experience that is too much for, whatever our capacity is to make sense of or understand or integrate, feels too threatening, too dangerous or overwhelming. And so
to start,
we start with
develop it.
Yeah. And so then it makes sense to say a little bit more about the history of trauma, because there is a bit of a history of trauma, and it's sort of an interesting one in the world of contemporary psychology, where trauma was sort of in favor, then out of favor, then in favor again, and we sort of come full circle. Because originally trauma, I think the earliest traumatologists worked in the 1800s, if I'm right, Richard.
I'm thinking about Pierre Genet and his triphasic model of trauma. I don't even know if he called it that, but that's what it's become.
Right.
Yeah.
So there was there was sort of a proto or a basic understanding that sometimes the experiences that people have are too much to bear consciously, and that can be impactful to them. It can change something about them. It can induce pathology, if you will. And then, of course, trauma represents an important component of like early psychoanalysis. Just is sort of an essential component of Freud's theorizing around neurosis and psychopathology, in his work with many of his patients and early psychoanalytic theory. And it's remained
William James as well, like variety of spiritual experiences. And I'm also thinking like Charcot and hypnosis and kind of early talk about what dissociation is, right? There's these things that were just so much to bear. A lot of, sexual abuse that was just not talked about in the Victorian era. Mm-hmm. And so it became separated, dissociated, and then these hypnotists would be able to begin to access that. And as we know, Freud trained under some of these as well.
Yeah, that's right. He did. Yeah, right. But then there was sort of a period where trauma fell out of favor.
Yeah.
As the behaviorist and cognitive behavioral orientation sort of took over.
50s, 60s.
Yeah, 70s, 80s.
Early 70s.
Yeah. And there was less of an emphasis upon trying to strike at or grasp or work with some kind of traumatic core to a person's experience as sort of the center of their pathology, and more an emphasis upon using techniques and skills that sort of did something to the system or the symptom, sort of manipulated the symptom. So if I'm depressed, I'm not searching for maybe the core traumatic experiences that structure my depression. I would go to a psychotherapist and I would be taught skills or techniques or have some kind of other therapeutic experience that's more just meant to take the symptoms as they are and work with them in their present day context. And so trauma was kind of out of favor. And then I think, we should make reference to the dawn of the pharmaceutical era as an additional impetus to taking trauma off the table. We no longer have to understand people's psychological problems as even a function of trauma or, developmental experience at all, but just as a function of brain chemistry. And so there's sort of an increasing disinterest in any kind of traumatology. But I think it was 1991 or 1990. When did Judith Herman publish her seminal work on trauma?
Yeah, that sounds about right. Around then.
Yeah.
Trauma and recovery, right?
Yeah, that's right. Yeah. Sort of Judith Herman's work and her emphasis upon what she saw as a special type of the population of people that she worked with who seemed to have experienced significant, overwhelming and numerous and significant overwhelming experiences in their childhood and youth, and that this sort of she understood as an essential component of working with and resolving their present day symptomology. And I think it was her and a number of other theorists, mind you, as well, that brought trauma back onto the stage in some ways.
And Herman also really highlighted how society is complicit in traumatizing people. And I really, that is what struck me most when I first read Herman's book. I think one of the subtitles of the book is The Denial of Trauma, Trauma in Society. And yeah, that struck me deep. Oh, okay, well, trauma isn't just an individual piece, that our society really does not want to look at it. And in so doing, people stay very stuck, and the issues that maybe, or the trauma and the disconnection with oneself and others could be dealt with, but society chooses not to. Mm-hmm. It's too expensive. It's too hard. Yeah.
I've never read Trauma and Recovery, so I'm a little bit.
You got to read it.
I really do. Yeah. No, I mean, it's on my list for sure. Mm-hmm. I've seen Herman referenced numerous times, so I understand like the significance of her, even if I haven't read her. But yeah. No,
it's quite political and strongly feminist. It's great. Yeah. No, I think really that was the only point that I wanted to make about that. And we've talked about that in other episodes. We could reference a few different episodes going back to look at the impact of capitalism and colonialism, materialism kind of on the structure of psychology, Industrial Revolution, marketing. So Philip Cushman, the episode on Philip Cushman. What was that? Yeah. Was that episode 10?
No, episode 9.
Episode 9. Yeah.
But yeah, without trying to sound too much like an expert of the history of trauma, but at least trying to just reference what I understand about it.
Just some key milestones.
It's like I understand like Herman's work was seminal, and that there have been a number of other theorists that were sort of working, not necessarily like, in tandem with her, but like in similar veins of thought that have sort of become popularized again, like the work of Richard Schwartz and the internal family systems approach, Janita Fisher, and her sort of integrated approach around trauma, Diana Fasha's AEDP, and what's her name? EMDR. What's her name?
Why do I not remember her name?
You're the EMDR guy, Richard.
Oh
You're supposed to
man,
know.
it's been a long week.
We can't talk
Francine
about it.
Shapiro.
Francine Shapiro.
Oh
Thank
my
you.
God.
We can't do an episode of on trauma without talking about.
I
Francine
think I'll
Shapiro,
get excommunicated from the EMDR community, but that's okay. Also, there was an era kind of in between Herman and what you discussed, like Schwartz, etc.
Yeah.
The late 90s, early 2000s. We'd be remiss if we didn't mention like Bessel van der Kolk, right? Mm-hmm. The Trauma Keeps the Score. There's other books, in the 90s. The 90s was, I think, quite a seminal time. Feminism had a strong influence. Queer theory, anti-racist, anti-oppressive theory got discussed a lot, whether bell hooks or whether Herman or others, many.
Yeah.
But then it moved into, I think, van der Kolk, and then I'm thinking about like Bruce Perry, The Boy Who Was Raised as a Dog. Quite strong probably in the neuropsychology piece, right? Of, okay, well, there's medication, but these medications maybe are not still as effective as we like. And a lot of talk around a modern view of attachment and like patterned rhythmic therapy, talk therapy, realizing that talk therapy would have its limitations. So introducing, some of these other things that then got further developed, right? Like EMDR, further development in EMDR, IFS, etc. So it's a fair question that you open the whole podcast with, right? One might think by looking at PESI, for example, that, I guess there's just enough treatments out there. I just got to learn enough. And then, my clients will be right as rain.
Yeah. I think like the proliferation of options and approaches around trauma is ultimately a good thing. And I think that like the repopularization of trauma is also a good thing, right? It's a good thing because I think as mental health professionals today, we would say we'd be hard pressed not to understand a person's experience in the context of trauma. Trauma adds an important contextual element to our work that we kind of can't go without, right? It provides a meaningful explanation for why people struggle the way that they do. And without it, we're left with a model of humanness which is kind of mechanical, right?
Yeah.
And inhuman in some ways. The concept of trauma says something important about us. It says that we ultimately have a relationship with our world, and we're sort of in exchange with our world. And that's kind of essential to who we are. Such that when there's trouble in that relationship, or what comes to us in that relationship is too much, we need some way to protect ourselves, right? Like trauma speaks to the language of our vulnerability as people and our situatedness in our life. So in that sense, I feel it's indispensable, because I think if not, we're sort of left understanding ourselves more as just, our thoughts and our feelings, or, too abstractly. We might not think of ourselves in a way where we take up our vulnerability as essential. So it's a good thing. And I think the proliferation of approaches meant to address this is a good thing too, because it provides many different options and perspectives.
And some may be better understood and fit within the frame of reference for some better than another. So yeah, it is nice to have some options. Agreed.
I would say, like, maybe if we sort of start, a critical analysis of the space, maybe where I'd want to just start is just around the idea of trauma as a disorder and sort of the disordering of trauma tonight. Like, that to me represents an interesting space where I could maybe feel some, I guess, kind of disagreement with the logic of that. And I'm not saying that trauma doesn't cause problems. I'm not saying that trauma isn't or couldn't be understood as the source of pathology in some ways. But what I'm saying is that maybe a better way of thinking about this is just that trauma itself is not a disorder. Maybe we need to think about it like that, right? I think there's this sort of idea in contemporary psychology that trauma is a sickness. And maybe what I need to do is sort of reference the perspective from Mark Epstein's book, which is another book that we've read tonight, because he provides a counter logic to this notion. And I think it will clarify my point that I'm trying to make here. So the other book that we're referencing tonight is a book by Mark Epstein, who's a psychiatrist, sort of psychodynamic psychiatrist in the United States. He wrote a book called The Trauma of Everyday Life. Mark Epstein in addition to being a psychiatrist, is a Buddhist, and his book is essentially a sort of looking at Buddhism as a kind of trauma therapy, as a way of understanding and working with trauma. It's a really beautiful book that sort of takes an integrated perspective. He has a reading of the Buddha and Buddhism that I think is profound and important to our discussion of trauma. And I guess his first and most profound point is this idea that trauma is something natural and something that occurs sort of every day. There's an everyday kind of trauma that we all have experienced. So from Epstein's perspective, trauma is not something that is sort of outside of the frame of normal experience. It's not something that warrants a kind of special attention as something abnormal or strange. He sees trauma as just an essential and inevitable component of living. He feels that everyone is limited in their capacity in some way to deal with life, and that life actually brings problems all the time, constantly. If you ask anyone if they've had trauma, they have. This was a reading of one of the Buddha's, sort of interventions with a person, right? Is they lost a child and it felt really special and significant in that. And, the Buddha essentially directed them to see that actually everyone has suffered the loss that they've lost in some way, or that everyone has suffered loss of a similar type. That there isn't like the pain that they're experiencing is not necessarily something of a special or unnatural order. So I think maybe that's the language that I want to use, and that's what I mean by disordering in some way. And that is the value of sort of Mark Epstein's perspective on trauma. Trauma is not abnormal. It's not unnatural. People experience trauma. And so putting trauma in the DSM, situating in this the trauma as sort of something of an illness, it kind of implies that trauma is not something that is endemic to life, is something that has its own kind of special category outside of regular human life. Yeah. And I think that changes the way that we think about trauma. And I think it also changes the way that we think about ourselves, right? Because then there's this idea that our normal waking life, our normal human life shouldn't have trauma in it, that trauma doesn't belong in some ways. And I think that's what I'm speaking to. This
trauma
idea
is something that happens to someone else.
Yeah. Mm-hmm. Or that trauma is avoidable, that trauma doesn't have a place in a person's life.
Yeah.
Yeah.
There must be something wrong with you if you're traumatized, so to speak.
That's right. Yeah. Or if you do have a traumatic experience. I think it's very normal when you have a traumatic experience to feel like it shouldn't have happened. And that's kind of the logic of trauma in some ways, right? Because you weren't
maybe
prepared.
Our society reinforces some of these.
Sure. But I think when we situate trauma as something special in the DSM and as something abnormal,
that's right, we
send a certain message to people that trauma isn't something that everyone experiences. And I think that's just not true. That's just not true. And so that kind of becomes the first space of my critique of not all of the contemporary, because not every, like so many positions in counseling and psychotherapy today don't take a pathologizing approach and don't take a DSM focused approach. And so like many of the contemporary approaches that we're describing and have described earlier, they don't take a pathologizing stance around trauma, but some do. And there is
absolutely
this place. I mean, it's in the DSM.
Take a symptom reduction approach.
Yeah. That PTSD is a disorder, if you will, right? Yeah. So I question that. I question the value of disordering trauma. Do we have, maybe I start with a question then, Richard, does trauma have to be a disorder in order for us to understand it as a problem worth attention?
Depends if we want to get covered by insurance or not, especially if we're in the States. But that's how these beliefs get reinforced. And I think can create a lot of stigma for people for seeking help. You're right, there's a lot of dangers about the pathologization of trauma. There's a lot of othering that happens when we pathologize trauma. Like Buddha, essentially, in Mark Epstein's book, had this, as you said, it was a great example. This woman that lost actually her whole family. And she was told by the Buddha to go house to house, essentially see if you can meet someone who hasn't suffered something, right?
one of the issues that comes up when disordering trauma is trauma becomes another disorder which needs a managed treatment, right? Or a symptom-focused treatment. So we understand trauma as a disorder. We think about it, primarily as a function of a disease process. And so then we construct a treatment around trauma that tries to manage or reduce the symptomology of the trauma, as opposed to thinking about trauma as something else, like as something more essential or more normal, I guess, right? Something warranting or requiring a different approach. One way I'm thinking about this is like if we only understand trauma as a function of a disease process and only kind of understand it in its symptomology, we might put excessive focus on the dysregulation that comes with trauma. We might focus on trying to dampen the dysregulation as a treatment for trauma. We might feel that in some ways the dysregulation that comes with trauma is the problem in trauma. And so our focus, if our focus lies on the symptomology, we might actually miss something essential about trauma, about what's happening in trauma. Does that make sense?
Yeah, I think it does make sense. And I think, trauma is, two people can experience some horrible event and one person can be traumatized about it and another person may not be. Mm-hmm. Like, it's my understanding, and maybe we will dissect this further or counter this, I don't know. But, that's the question, when clients come in, am I traumatized? Is this trauma? They sometimes want some validation for what they've been through. It's really bad, right? And they've dismissed themselves in a lot of ways, right? Oh, no, it can't be that bad. Mm-hmm. And so they come in with those questions.
Yeah. When we just think of trauma as a function of a disorder, like we just think about it as a disorder.
As a bad thing that happened.
As a bad thing that happened, and we just focus on sort of the symptomology of trauma, we miss something important, which is that trauma is in some ways just reality happening to us. Like it's just reality sort of rearing its ugly head to us. And there's something important in doing, I think, the opposite of what our instinct propels us to in trauma, which is to try to like protect and soften,
yes,
and insulate, and that is to expose and to feel and to grieve and
very hard, but important,
and to sort of take in.
Two horrible things could happen, to someone very similar. They've lost a child. They've, we might say losing a job, right? To one person, that is, the impact is great and they are frozen and they are, and another, I think, part of the definition of trauma, I would like to say, is probably similar to Gabor Mate of it's a disconnection from oneself, right? It's a disconnection from others. It's a pain of disconnection that's overwhelming. Mm-hmm. Mm-hmm. And an abandonment and an exiling of self. And I know we'll talk more about that with Kalsched's perspective. But the interpretation, right? I'm thinking about Milton, right? Man can make a hell out of heaven, a heaven out of hell. Mm-hmm. How we see that event, how we've been trained, programmed from our past experience, whether we have a spiritual or existential or meaning base to make sense of our experience or not, whether, again, we are connected to others or not. I would say greatly kind of determines whether that is an adverse experience or whether it's traumatic.
Yeah.
But I'm open to, maybe there needs to be a shift in language. I'm open to what your thoughts are. But
No. That's good. The sort of the idea of like, are we rooted enough to deal with this, right? Like, do we have sufficient connection? It raises the question of what makes something traumatic. I think that's sort of a question in addition to this that we can speak to. We're sort of touching on two things right now, so I want to just make sure that we sort of cover. So I think, okay, and maybe the way to converge on these two things is to sort of bring in the idea, like, I don't really know who owns this idea. I think Epstein referenced it. I'm not sure if it's a kind of exclusively psychodynamic idea or if there's other modalities that would share this positionality. But it's sort of the idea that like trauma lays within a spectrum of normal human experience, like that all human experience is, and all human development is kind of engendered by trauma in some ways, that like, we kind of have like our understanding of the world and our relationship to it and our capacities for it, right? And then when something new enters the world, that can stretch us, right? We sort of have to make room for that, and we have to accommodate it, right? And that's important. That's a function of growth. Like that's, when we can stretch to accommodate something new that we don't have a relationship to and we don't understand. That's
I love
what propels
that.
growth. Yeah, yeah.
We have
And
to
so,
make room for what we previously could not conceive. We cannot make sense of it. It really challenges us at a philosophical, spiritual, kind of every part of us level.
yeah, that's right. That's right. And so, like, we would just put trauma on the extreme end of that normal and essential process for human
I like
development.
that.
Yeah.
The spectrum continuum idea. Yeah.
Yeah, which is just like sometimes there's an experience that is so big that it's
Yes.
too big for us to make sense of. And so we kind of lose the capacity to integrate it, and something else kind of rushes in to protect us.
Yes.
But then we kind of get frozen or stuck in that position. We can't move past it in some ways. And that's in some ways trauma. So I think, just saying that then and going back to the idea of disordered, the disordered nature of trauma, right? Like, or an excessive focus on symptomology in trauma is like one of the issues with that is that does nothing to sort of restore the process of integration that is necessary in trauma, or it doesn't ultimately support it, right? When we focus too much on symptomology and symptom reduction, that ultimately we need to retain a capacity to like help the person to open, to be open to what's at the center of trauma.
And just like grief work, if people feel like my symptoms are not resolved, because DSM sets guidelines, timelines, that if my symptoms aren't resolving fast enough, again, with the nature of traumatic experience, how it impacts our thinking, there's likely some pre-existing beliefs there that maybe all of us have. It's, oh my gosh, it's so stigmatizing. There's this internal stigmatization that happens of, I guess I'm just not good enough. I guess I'm not a good enough client. There's something defective with me. This gets really reinforced, right? So if we're, and as therapists too, we can feel that. I want to acknowledge that. Oh my gosh, I'm thinking back. This is giving me PTSD. No, going back in time. No, it's good to process this. In many ways, I think becoming an experienced holistic therapist, whole human, we are healing from maybe some of the impacts of splitting, a really dualist, perspective, at least especially at the time that I went to grad school about 10 years ago. It was still, spirituality was just starting to kind of be discussed a little bit more. I had profs that said, do not, if you want to kill your career, you'll talk about spirituality. And now it's like, we know that it's a critical part of the healing process, and for people to understand themselves and the world, and can be just so beneficial to tie those assets in.
I'll bridge off that,
Please.
Richard, because I think in some ways what you're speaking to is the idea that our subjectivity around trauma is essential to its resolution, that we can't sort of treat trauma as this objective process using solely objective methods. Trauma is ultimately about our relationship to our life and the meaning that we make around it. I think when you're making reference to spirituality, I think you're saying something of that, right? That trauma is not just what happens in your brain, it's what happens in yourself. What happens in your soul?
Yeah, absolutely.
Just as an aside, I think it's really interesting. You went to Trinity Western University, and that there were professors at that university. Trinity Western University, for our listeners who don't know, is like a Christian college, and interesting that there were professors saying, "Don't talk about spirituality."
It was more. I would say it was more in my bachelor's.
Okay.
But probably at Trinity Western, no, not so much. I think that was actually quite refreshing.
Sure.
But
Sure.
even as I was looking at other graduate programs, or looking at, again, from bachelor's going into different graduate programs of potential graduate supervisors and those kind of saying like, oh, I don't know, this is not what we like, something harder, right? About this, develop this assessment, this inventory. So actually at Trinity, I think it was quite refreshing. And I think I hit upon there at a really good time with some profs that had a good amount of research and very applied research into people's grieving, for example, grieving the loss of children. Derek Clausen, a great mentor, and others that were working, Martin Bertel, who was working closely like from a satir model, training a lot of therapists from China, but training therapists, in MCFD, in really taking a family approach and away from an individualistic approach. So there was great kind of scholar practitioners and a very diverse class of Buddhist, agnostic, Christian, Hindu. So I particularly, even the cohort that I came into, there was something, the stars seemed to be aligned because I also was in an incredibly diverse cohort, right? But I'm saying at that time in psychology, the zeitgeist of the psychology world was still, spirituality was just like, maybe, I don't know how much we should explore this. It's just so individual. Is it is it offensive to bring up, right? Yeah. What is the place, right, of spirituality in treatment, if any? That was the question at the time. And now it's like, well, of course.
Well, of course. Yeah.
Yeah.
No, that sounds like it sort of coincides with the primary positioning at that time, which was more around finding the sort of general understanding and objective understanding of psychological phenomena, an understanding that was devoid of the subjective noise that would complicate just our understanding of what's going on for people. And I'm thinking about, this sort of notion of disordering trauma as an effort in that direction. If we relegate trauma as a psychological disorder, that puts it in a place where we can sort of explore it objectively and try to understand what it is that constitutes trauma. And then if we understand the mechanics of trauma, we can treat that. We can develop a treatment protocol that does that. And that's what I mean by there's some sense of eliminating the subjective, and that the spiritual and the subjective, I sort of use those two terms hand in hand. Just the idea, like my position, Epstein's position, Kalsched's position, the subjectivity needs to remain at the heart of understanding trauma. We can't understand trauma without understanding the person's subjective sense of their experience, what makes the event traumatic for them. And that, of course, is complicated, right? But essential. So I recently came across a study from the University of Texas at Dallas and Baylor University Medical Center that was looking at the role of vagus nerve stimulation in the treatment of trauma. And I believe that the study looked at a combination of CBT, so like trauma-focused CBT, and as well as incorporating vagus nerve stimulation, so sort of a new technology which uses, I think, a device that you connect around your ears that provides a kind of gentle stimulation of the vagus nerve. And what they found was that quite astoundingly, actually, in 100% of the people that they treated with this approach, they went from qualifying for a diagnosis to no longer qualifying for a diagnosis of PTSD after the study. So a pretty remarkable reduction in symptomology. On the one hand, you might think of this as like an incredible advancement in the treatment of trauma, hugely significant. And I certainly don't want to dismiss what it affords in terms of its capacity to help people and to reduce their suffering and such, right, and their symptomology. But I guess I'm sort of keeping in mind this notion of the subjective at the heart of understanding and treating trauma as, or sort of the concerns around disordering trauma and the implications for treatment. I guess I just want to sort of raise this as an example to talk through of like, I just don't know how to feel about this, I guess, Richard, this study and what it's suggesting, right? Like I'm just not so sure. I guess it's not that I don't believe the results. I think that it's demonstrating something, but I just wonder what it's demonstrating though. And that's maybe the questions that I would want to raise. Like, I'm just really thinking that the study shows something in the reduction of symptomology, but does it really show any type of substantive psychological change? Does it show the people as having grown at all? I don't know. They didn't include any qualitative measures, so I can't understand. But yeah,
as often that happens in clinical trial type studies. Yeah, they don't include that.
I bring this up though, I guess, as a contemporary example of what's happening in the space of trauma treatment right now.
It's a good example.
That raises the question of subjectivity in treatment of trauma. Can we get away with avoiding it, right? Can we get away with ignoring subjectivity? Can we just stimulate people's vagus nerves enough that they're healthy?
All right, well, I think we got to refer back to the episode on Jonathan Shedler, right, about the problem with clinical trials, just really quickly, in the sense that could there be likely symptom reduction? And in this case, a very significant symptom reduction, probably a large effect size. Again, I haven't read this study, but very reputable institution. And yes, but Shedler points to, well, as you're pointing to, how long do the changes last? But really, and looking at what happens in long-term psychotherapy is different than what happens when we look at things short-term, a short-term manualized CBT, as I think was even mentioned here, a change of how one views themselves, identity level change. It is a different level of change. And I think I also worked or have had some good discussions and did a little bit of training with a wonderful clinic out of Toronto, Eterna Health by Dr. Adil Khan, and there's several other doctors there. And they're working with soldiers, they're working with high performance athletes, politicians, all types of people, sport coaches, etc. And one of their treatments that they do use is vagus nerve stimulation, and quite effective at reducing the symptomology of it. So definitely a very interesting treatment and something to be regarded, because if people are in a complete state of hypervigilance, they can't bring that down. It's really hard to even have discussions around meaning, right? Like even the verbal processing that we would typically have in talk therapy is just some of that, just info is not going in. I can think about times, even for myself, when I've been kind of stuck in like a very dysregulated state for weeks, potentially weeks at a time, right? Like panic attacks almost every day. Like until that comes down a little bit, it's hard. But then after that, right? Or once I can get a little bit of breathing room, perhaps literally, then maybe the real healing begins or needs to begin.
Yeah, thank you for all of that, because I think that's really good. And so I think that's a nice way of speaking to, I think what I'm trying to get at with all of this is that trauma, like the space of contemporary trauma treatment in some ways represents the problems that we were talking about in our third episode around sort of symptom management versus healing transformation. And, through the work of Jonathan Shedler, which is like, what are we really doing, right? Like, what are we really doing? And does this excessive focus on symptomology, does this disordering of trauma actually afford us the kind of opportunities that come with trauma treatment? Like, have we kind of dug ourselves into a corner in some ways by only thinking about ourselves in terms of disorders and symptoms?
Yes.
Are we missing an important element of what trauma treatment can provide and what trauma is for people? And this is why I make reference to this sort of idea of trauma as something everyday, trauma as on this spectrum from sort of the trauma of normal development to the trauma that overwhelms us. Because trauma is a door, I think, right? It's a door to something more. And so if we don't understand that, we miss what it can provide us. Maybe that's the radical position here, is like trauma actually affords us something. It provides us with something. And that's not always captured in our contemporary perspective on trauma and trauma treatment.
After we brought the symptoms down, we still are struggling sometimes with a sense of meaning. We're trying, it's a meaning making process that really has to happen. So I don't argue with the results of the study. And I love that you point out, well, what's missing? What happens after? What's the long term? These are very good things to bring up.
Yeah, it's like, what does this mean to people? And I think for me, thinking about trauma more from this growth-oriented perspective, like what comes from this treatment for people? Were they able to take something in about reality that they couldn't before? Did they grow around this, or did they just not have nightmares anymore? Because to me, those are two different things. Not having nightmares does not mean you're better. It does not mean you've healed. It does not mean you're through, what's happened. There's this, we need to.
Well, and we've talked about before, what a low kind of opinion of what trauma, of what therapy should be, right? I guess that is a discussion. And that's a common criticism of therapy is, well, therapy's great if you're really fucked up. But if you actually are trying to improve your life, maybe you should get a coach. Like if you're really looking at how do I be happy? What is the good life? In enhancement, right? What is life? Why is life worth living? Right? Go see a priest, go see a life coach, right? And yet do we maybe abdicate responsibility by doing that, right? Positive psychology is a whole area that explores like, okay, there's something beyond just the reduction of symptoms.
Yeah. Well, and do we really understand how trauma represents a barrier to the good life? Like, do we understand how trauma impacts people? I think that's something that we can raise as a question. Mark Epstein, he wrote something really brilliant in his book. It's the idea that, we often mistake like knowing where and with who our trauma happened with as really understanding our trauma. Right. And I think that he cautioned against this danger in that thinking. And I think that was really wise, right? Because just understanding the concrete details of your trauma really does nothing to, I shouldn't say nothing, but it does very little to support, sort of a healing process around trauma, right? Because trauma is not just the objective details of what happened. It is the subjective impact of the experience and the meaning made around it. And I think that, well, I shouldn't say I think that we as, a community of therapists don't do a good job of this, because I think that's not true. There are a lot of trauma approaches that make sense of this, but there's certainly the risk of just not thinking about ourselves in that way, and of missing the subjective impact that trauma has, right? And of not being able to deftly work with it, like to work with it effectively and understand. Yeah.
Well, I think society misses out too. I'm thinking about, and I'll always be grateful to you for introducing me to the book Psychotherapy East and West by Alan Watts. And he would argue that if a person is not empowered or enlightened in his sense of being able to kind of have a critical view of the world, of being able to help others, right? If there is not some action of being able to help others, others relieve suffering, which is that's what he views enlightenment is. Are we not just, okay, people's symptom is reduced? And I do want to have some trust that sometimes when people's symptoms are reduced, there is kind of an inner healing, potential that for some people that might be enough, right? That they can then reconnect with themselves and move forward, and healing continue kind of just even naturally on its own, right? There is, I think, people like that. But for maybe many others, right, it's okay, well, and we've talked about this again in the Cushman episode too. Okay, so we've reduced trauma, we've reduced symptom of whatever disorder, and then are we just putting that person back to work, back to the factory, back to the battlefield, right? We don't want them to question what is, as we mentioned, the good life. What is am I living that? Am I living according to my values? Am I participating in unethical actions that are hurting others, hurting the environment? And so I know Alan Watts would say, well, this is not far enough. He would probably be quite critical of the limitations of kind of just taking a RCT kind of approach, for sure.
Sure. I think we're talking about two different but equally important things right now, Richard. I think you're making reference.
I think we do that in most episodes.
No, it's good. It's good. Because I think you're making reference to the idea of like when we only focus on trauma symptomology and sort of teach a person how to regulate, if you will, but do nothing to address the systemic conditions that traumatize them. I think in some ways that's what you're saying. Then we're not really affecting any type of substantive change. And I 100%
as well as exploring just, the meaning. What was the meaning of this in my life, right? And I, you know, that's important, right? What was the greater meaning? Does this connect to also maybe, greater meaning in society? But being out of alignment with my values, what would that look like to come back in alignment? So it's both an individual and systemic kind of view.
Mm-hmm. Yeah, I think they're both essential, right? To take time to appreciate the inner impact of trauma, the inner experience of trauma. Like we can't just reduce trauma to what happened. I'm going to keep coming back to this point until it bleeds, right? But I think it was so important, and it really, to me, it struck me as important, right? Like we can't, maybe I'll just use an example to speak to this, right? Like I think, because I encounter a trauma regularly, in my work, right? And I encounter lots of traumas regularly in my work, actually, but I'd say one that I encounter frequently that I'll talk around right now is like when you're an adult child of a parent who is diagnosed with a grave illness like cancer, and, you're facing their imminent death. Right? This is a traumatic experience. And, so we would understand it as traumatic. But then the question becomes, and maybe I'll just hold it as a question for a bit and we can speculate, Richard, why is this traumatic? What makes this experience traumatic, right? What is it about this that would be traumatic? Do you have any ideas? Do you have any hypothesize? I want to.
One thing that comes to mind right away is sometimes I thought of the reverse too, right? Like, and those are people that I have worked with. It actually helped influence me to be a therapist, was working at Camp Good Times that was set up by Canadian Cancer Society, and working with the children that have, many of them have terminal illness, and then their siblings, cancer, right? Stage 4, etc. And something about that, and we talked a lot about that, was that maybe the infrequency or the unnaturalness, it shouldn't be that a child should die before a parent. I know you're talking about the reverse, but maybe there's something about the element of, even in the reverse of like a parent, well, okay, this is something that maybe only happens once in our life. I think there's something about kind of the frequency of this, something that because maybe it hasn't happened to us before, we feel like, okay, this is something that happens to others, right? And not ourselves. And also, even in this example of parents, is like, okay, well, the parent is the guide. How will I function when, my guide is gone, my light is gone? I know definitely clients will discuss that.
Yes. Yeah.
Just initial thoughts coming up.
No, that's good. I loved I think your hypothesis was great there. Thank you for indulging me, Richard. Yeah. I mean, how I often interpret the experience of my patients when I meet with them, like as I listen to them, is around the idea of like the function of a parent, right? Like, because these adult children are still children, and there is still a dynamic of dependency upon their parents. There's a part of them that still sees their parents as a protector and someone who provides for them, and as kind of a piece of insulation against the starkness of reality. And so the loss of the parent represents a tremendous experience of exposure, of no longer having this protective person in your life, of being the adult. Like it's a kind of growing experience. I'm on my own. I'm truly independent now. I don't have a parent that I can fall back on.
That's right.
Yeah. And so, it doesn't help just to focus on the experience of loss or the truth of the loss. Like certainly saying, oh, my parent is going to die and I'm tremendously sad about that is fine. But if I really want to help someone with this kind of experience, we need to look at the dynamics of dependency. We need to understand subjectively what is happening for this person inside, right? Which is like they're reassuming a position in their life now where they have to be sort of more mature. They have to be more independent. They don't have that protective person.
That's it. There's a role change or a role flip, perhaps. Yeah.
And for a lot of people, then the question is, are you up to that task? Do you feel prepared for that?
Yeah.
What would make that problematic if you don't feel prepared for that, right? Like we can look at the barrier, like the experiences of barrier.
What does this trauma really mean to me? How does it impact me as a person, going forth into life?
Yeah, who will I be after they're gone?
Yeah.
Right. Yeah.
Who am I without my parent? It's the rug, that's the saying, and the rug pulled out from under me, right? And again, alone, naked and afraid. I think you said that really well, right? I'm on my own to bear the brunt of stark reality. Yeah.
I think Yalom had a good quote around this, which was like, when you lose a parent, it makes you feel one step closer to the grave. There's one less person between you and the grave. I can't remember the exact quote, but he just
wow.
Said it right?
Yes, that is impactful.
And it's true, right? Like there's a kind of exposure that comes with that.
Reminds us that we're not invincible. We're not untouchable in any way.
Yeah.
It's very humbling.
Absolutely. But I think I just bring that up as an example to speak to the kind of subjective dynamics of trauma, right?
Yes.
In a basic way. And you made reference to it earlier, Richard, and so I'll sort of touch on it now. Like my concern with the excessive focus of neurobiology in our understanding and treatment of trauma, like I sort of take the position that we talk too much about the brain, that we focus too much on the brain as an explanatory vehicle for what's happening in trauma. And that actually creates the problem of pulling us out of making sense of the subjective.
Yes.
Yeah. I mean, what would it be? What would it mean if we talked to these adult children of their dying parents through the language of the nervous system, right? Would we actually capture their experience? Would we speak to their real vulnerability if we did that? And so I question...
It intellectualizes when actually there is a soul wound, there is an emotional wound, a somatic wound.
Totally, yeah. I think that like where I first had this experience was doing some trauma-informed training when I worked for MCFD a number of years ago. I went to this training at the Justice Institute, and it was meant to be like a trauma-informed training specifically for child protection workers. And so I thought I would get like some really useful information about how to
I remember you complaining about this to me.
I did. I
already have a conversation.
I know. We talked about this, but good for the audience to hear too. Like, because working in child protection, you're working in a trauma.
It was 8 years ago.
Context. Yeah, it was. Yeah. it's a trauma laden context, right?
Yes,
And like,
so much so.
yeah, just like trauma on every level, trauma for the kids, trauma for the parents, trauma for the
Absolutely.
workers. Yeah. And so I really thought, okay, well, and trauma was still kind of a fresh concept to me back then. I hadn't really read a lot about trauma and was still learning more about it. And I thought, okay, well, I'm going to be really instructed on how to deal with trauma as it comes up in the work that I do, right? Like speak to my clients more effectively, attend to the dynamics of trauma that manifest in the work that I do with my clients, things like that. And instead, I got like a day and a half of
Oh God.
neurobiology. Like, I swear to
Were
God.
you like, kill me now?
And it was like, and I remember I left, my friend Deandra and I had attended, she was a coworker of mine, we'd attended the training together, and she was just like, that was fucking useless. And it felt that way because like, I mean, it was taught by this lovely trauma therapist. And I don't doubt that like she's really good with her clients. I think she didn't know how to communicate about trauma in a way that would be relevant for us. Like she was kind of like,
And the
she was,
healing of it. It's like you know the parts of the brain now really
Yeah.
well if you didn't know them already.
yeah,
But
Yeah, there to me, I think part of this
Yeah.
like emphasis on the neurobiology of trauma is that it's sort of like I think that there's this concern in the psychological community about validating things through neurobiology
oh yeah.
because
We have to
we're
be
so-
more sciencey. We have to
Yeah,
be just
yeah.
as legit as the medical. Yeah. And
yeah,
therefore all explanations must go through that way.
for sure, yeah. So
It really
without
constrains us.
without that neurobiological piece, what do we can we really say that we're speaking to something true?
We're just doing voodoo.
Yeah, which is sad, right? Because of course, again, we're dealing with the subjectivity of our patients. That's something accessible to us, if not perfectly, like it's still there. We can speak to it, we can see it. But of course, it's not enough, right? So you have to talk about it in terms of the brain. I learned nothing from that training, and so I think that speaks to the basic problem, right? Which is like the language of neurobiology. It can be useful. It can
Some elements are useful.
yeah.
Sure.
Yeah, it can like for patients who really have no relationship to their experience, it can give them like a way of
Or
talking
even
about
for
what's
the
going on.
therapist too to understand, okay, because again, trauma affects spiritually, emotionally, physically, okay, of what's happening, right? Yeah. And for the client, okay, there's something happening. But again, if that's the only way of knowing or the only plane that we're discussing, or if that's the dominant plane we're kind of privileging, wow, we're missing a lot.
Yeah, 100%.
Yeah.
100%. Yeah.
Because I definitely do include some psychoeducation. I think I probably always will, some psychoeducation about the nervous system. And sometimes it's actually reduces some of the pathology. Okay, like there's some things that are beyond, my control as a client. I wasn't, there were some elements here that were happening that were a bit beyond my control. So can reduce some of the blame, but oh my gosh, it's just one piece. Yeah.
Yeah. Certainly not like a fulsome vehicle that can resolve all trauma. Yeah.
No.
Yeah. If we can't speak to the subjective vulnerability of what a person is experiencing, I think we can't really reach them in the trauma. That's that's like a technical position I'm taking now, but that's yeah.
Mm-hmm.
I think that
one
that's
other
fair.
thing that strikes me is also because you asked that really good question about the parent with cancer, and I'm thinking about clients that I have that are from Israel, Syria, Afghanistan, Palestine, etc. Their life, they're all, they've described to me, well, I've always been, kind of under attack, right? Now I'm in Canada and things maybe are a bit better, right? And some that had a real difficulty, even understanding, when there's certain traumas. I can think about when there's the trauma that happened to the Filipino community in Vancouver, the car attack on April 26th. And unfortunately, in places like Israel or Palestine, that's something that happens very regularly. Suicide bombers blow up buses. And sometimes it really develops some calluses, I think, right underneath, right? They are very caring, very compassionate, but there is a desensitization. Maybe that needs to happen for a period of time to survive, but then there is a cost to that dissociation and that, okay, well, kind of like, this is totally blunt and not what a client said, but like, what are you crying about? Like, this is something that happens all the time, right? Like, I wouldn't even consider this like it was like bad. It's horrible that this happened, but like this is just something that happens, you know, in my country, in Syria, in a refugee camp, you know, whatever, every day, right? And so this idea around how frequently, how recent, you know, trauma happens, right? Is it happening to a whole population? And so, okay, I have other people that can relate to me. Is it happening just to a select few, so to speak? This shifts people right around because we're so influenced by others. Well, maybe I'm making too big of a deal of this, right? There's stigma can be amplified or decreased based on some of these factors, I think.
That's a kind of a nice segue into talking about defenses, I guess, right?
Yeah, I
Yeah,
think so.
The deadening sort of being a
Yes,
yeah,
yes, it is a good
yeah,
segue.
yeah. That's an important component of trauma that we need to understand too, is like that trauma induces defenses, and that's a natural component of trauma that we, you know, something in us protects ourselves. That's just that those are my immediate associations with what you shared, Richard. Yeah, yeah.
No, that's me too, right? It's like, okay, I need to deaden oneself or one's very human, and Kalsched talks about, right, this child part, right, that gets hidden away, right, in order to survive, right, put in a closet maybe, so to speak, right, in order to survive, and then you know might be very successful in your work, etc. But then clients are coming to us because they feel like they're sometimes half a person. They'll say, I'm cut off,
Yeah.
you know, below my head. Also in intimate relationships, right? Their relationship with their children, their relationship with their partner, things that are very vulnerable, really opening up to friends, sex, etc. Those are the things that really rise to the surface of things that they struggle with,
Yeah, yeah.
right? On the surface, they may look like a very together person.
Totally, totally. Yeah. Yeah. I like to think about us as sort of having a door to the world, right? And when the door is open, all the good things and also the bad things can come in, the joys and despairs of life. But then when there's trauma, sometimes the door is shut to keep us from further harm, but that means the good things are also kept at bay
I
as
agree
well.
with that.
Yeah.
Yeah, I say
Yeah.
that many times. Similar
Yeah,
metaphor, yeah.
yeah. I'm sure a lot of us do, right? Like that's been our experience. Yeah, Kalsched's work is makes a sort of unique contribution, I think, in the realm of traumatology. You know, I think that there's some consistencies between him and his sort of thinking in IFS, but he's a little bit different as well. His work really developed from working with a subset of people. I mean, the idea of trauma and defense is not new. It's not new to Kalsched, right? Like he, that's something that has been understood for a long time. But there was sort of a subset of people that he worked with. It seemed that progress in the therapy actually created a liability and made things worse in some ways. Like there was a stubborn
Yeah.
refusal for people to get better,
Yes.
even after what seemed
Yes.
like the initial work around defenses and opening and vulnerability was helpful. And this got him really thinking about how it could be that people could retain themselves in the same kind of position, could remain extra stuck, if you will.
Yeah.
Yeah. In light of, what was on the surface, at least, or I mean, not even on the surface, what was good, effective therapy. So his book, The Inner World of Trauma, sort of describes this sort of conceptualization of what he calls this sort of problem, I guess.
Therapists would often call these clients, and I think it's really probably a pretty stigmatizing term, but treatment resistant.
Yeah, 100%. And it's interesting to read Kalsched's history of this and to see that this kind of concept was understood even by Freud and many early analysts. They had different ways of talking about and trying to conceptualize this problem. I think that he's done a good job of articulating a clear sort of framework of understanding around this.
So clients where their symptoms are reducing, they're engaging more with life, maybe they're getting some more understanding about what's happened to them. And then there's a sudden decompensation, or there's still this just oppression that is striking them.
Yeah. And Kalsched's account of this is that in particular types of trauma, when the trauma is severe, when the trauma happens at a very early age, like in infancy, where there are only primitive defenses available to the person, that the kind of defensive situation that is enacted is archetypal. So for Kalsched, the idea of archetypal means it belongs to something very primitive and instinctual in the psyche, and something very, very powerful. So something that can sort of commit itself to action in a sort of profound and substantive way for the person, and something that certainly lies beyond conscious thought or conscious intention. And so these defenses, they're primitive, so they're very simple. They're archetypal, so they belong to sort of an instinctual category of being, and they're what comes in play and protects the person. And so later in life, as this person grows up, as the problem of vulnerability remains, as it does for all of us in life, right? These instinctual archetypal defenses often come into play, and they move hard and they move fast, and they are resistant to change and to sort of healing experiences. They don't take them in very well. And so he had a way of describing this functioning as daemonic. So a daemon being a kind of essentially kind of a devil, right? Like a spiritual being of immense power who sort of like manipulates or influences a person. And he titled this the self-care system. I just share all of this with our listeners because they might find it interesting, and
builds a lot on Jungian
yeah
ideas. Mm-hmm.
Yeah,
but he kind of tries to go even a step beyond, maybe.
Yeah. I think like the inner world of trauma, though, like just as a start, I know, Richard, you got some thoughts on this, and like we read it and are sort of taking it just as a place of like the complicated nature of trauma treatment, right? Like that Kalsched sort of articulates really complicated dynamics in the treatment of trauma, and that like there's a lot of people often that out there, I think, who like they don't get better from contemporary or like conventional treatments, and as a space of understanding, or
may even
that phenomenon.
Those are a certain percentage that therapy actually contributes to making them worse.
Mm-hmm. Yes, for sure, right? They have too many successive experiences of vulnerability, and the therapist doesn't understand how problematic that is for them. Yeah, doesn't understand that actually that is just too much. It's too hard. Yeah. Some of the examples Kalsched gave were just amazing, and like the one example of like the patient that he worked with who had watched a home video of herself and had seen herself as a young girl, sort of in all of her vulnerability and kind of the trauma in her family sort of happening in the moment. Then her and Donald actually held a special session where they could watch the video together, which was really quite moving for him. And the client really felt impacted by this. And so he thought that after he had been working with this woman for about a year, he thought, great, we finally had a breakthrough. I've reached her. She was grieving, some of her feelings as a young girl in this, an unsupportive environment. And then she had a dream, and the dream sort of signified this violent, sort of killing of the emerging vulnerability and connection that she was experiencing. And it really happened abruptly and violently and terrifyingly. And he struggled to make sense of it for a long time before he understood it as a function of this defensive and self-care system. So anyway, waxing all of that just to sort of bring in this idea of the complicated. Like if we get, maybe I would say it's like when we get subjective, we get complicated. So maybe that's
why so many people avoid it.
Yeah, sure. Because you have to spend a lot of time understanding this and how people work sort of on the inside.
It doesn't fit neatly into a 6-session treatment protocol, though, Glenn.
No, yeah, for sure, right? Yeah, we're out of this. We're definitely out of the space of protocols now. Yeah. Maybe you want to say some things on the place of the soul in trauma treatment. I know that's sort of within Kalsched's realm too, Richard. Like what, do you have some thoughts around that area?
Yeah, I think soul, it may sound like a particular religious idea, but it's probably not how I mean it. I think it's the sense of, and I was just talking with the client today, I think about this, that there's something beyond us that, or some part of us that is unaffected by the trauma or able to withstand, right? A core kind of protected, a bubble or something like this that is, and probably connected to like the collective unconscious, the child, the sense of the child that's pure and innocent, but also has wisdom. It's gained wisdom in this life. Maybe it's, depending on what you believe, maybe wisdom in other lives, ancestors. But essentially, it's this part that cannot be damaged by trauma, and that it continues to learn and grow. And different philosophies might talk about it too as like an observer as well, so that it's not that it doesn't see that trauma, but maybe just like the Buddha has a lot of compassion for the traumatized parts, if we want to use that language, compassion for self, compassion for others, connected to our values, connected to things greater. I think, this is how I explain it, or kind of, it's probably an amalgamation and just also, a little bit of a flavor that I come up with based on a lot of pieces, from internal family systems from Richard Schwartz, probably from my own backgrounds in Buddhism, contemplative Christianity. Again, as I'm reading more Kalsched, Jungian kind of pieces, those are influencing my work in psychedelic assisted therapy, and just that experience, seeing what clients have described, and also and them describing that to me, as well as my own experiences of what I've seen during psychedelic experiences or non-psychedelic, very deeply meditative experiences on meditation retreats, etc., or just certain moments, right, where time freezes, right? I'm connected with my child, connected to nature, connected to my wife, connected to something greater than myself, right? And so, yeah, those are some thoughts of what the soul might be.
I have a silly question, maybe, Richard, but it's just like, just wanted to let you rock on this more. So it's, I guess it's like,
Careful what you ask for.
Well, what makes it important for there to be something immutable in the context of trauma and trauma treatment? You're sort of speaking of the soul as something that can't really be fully damaged. And you're saying that's like for you, that's the really special or essential component of this soul understanding. So what is it about the immutability of the soul, if you will, that's important in the context of trauma?
That's a very good question.
Yeah.
I don't know if I have a really good answer for that, but one thing that strikes me is just when I've talked about this with clients, it's something, I don't know, it's something that's very reassuring to them to feel like I am more than my trauma, right? Trauma doesn't define me, that there was good things that happened before. Maybe I experienced some very particular traumatic events, and that perhaps there can be something good that happens after. It's not a naivety that, and maybe the self and the soul or even could be defined differently. I don't know. There's overlap. Different models, different people say different things. But in any case, it's not that after we've had a trauma that, we can just go back to the way that things are, because there's a wisdom that's collected, right? I think that happens as well, right? That happens in the soul or the self as trauma happens. Yeah, those are a few thoughts.
Mm-hmm. I'm just thinking about something that comes up in the imagery of Donald Kalsched's work, like the kind of like the defenses of the self-care kind of system, kind of wrestling for the child. He used an image, and I can't remember exactly what it's from. It's a kind of famous painting, I think, of these two angels.
Yes.
And he calls
Archangel Michael and Dis, I believe.
Dis. Yes. Oh, you're so good.
Oh man, I love the I'm listening to his second book, which is also amazing. I think maybe even better than the first, Trauma and the Soul, because he really goes into the treatment, but also continues to expand on the mythology, the patient's stories. He takes a lot of stories from probably Western consciousness of like Grimm's fairy tales, etc., and applies those to cases. But Dis is this basically like the devil, or like the devil's kind of like lead demon, little henchman guy that has 9 different heads. And because these are representing different disconnections within self, and that these heads also devour souls, right? So basically this dude's job, this creature's job, sometimes described as kind of like a 9-headed dragon or a 9-headed dog, is to devour souls, right? To separate people from themselves.
Yes. I know he loved the
and that's a reference to Dante's Inferno as well. Right.
Yeah. I know Kalsched loved the association with dis and dissociation or dysfunction.
That's right. No, it is the root word.
Yeah, that's
where
right.
It comes from.
Yeah.
He believes Dante's Inferno is actually like absolutely, for its time, it was, I guess purely a spiritual, but that was the spiritual way of understanding was a way that also people were trying to understand experiences. Those times were extremely traumatic. The time of Dante, people were executed, interrogated for almost anything, right? There was famine, plagues. It was very hellish. It probably wasn't that hard for Dante to come up with some of these pieces. Maybe it was a relief to come up with another world rather than the world probably that he lived in. Kalsched would argue that Dante was really a psychologist and was describing, was hitting upon some points that might be quite universal to humans around how they can be dissociated with them. It's a psychological metaphor. And he calls his method a psycho-spiritual method, right? You can't really have healing, he would argue, without great connection to symbolism, understanding of our ancestors, the collective unconscious, mythology, these stories. If we don't understand where we came from, won't understand about ourselves now or where we're going, right?
That's right. Yeah.
He would argue some of these points.
Yeah. Like mythology as a sort of reference to a psychological reality. Yeah, I mean, like one of the analytic techniques of trauma treatment would be like dream analysis, right? Like the dream would signify something of the person's inner experience that might allow for analysis, right? And and within that analysis, there might be some kind of work in the direction of integration and healing, right? Of understanding and making sense of the person's inner experience. Yeah. But when in referencing that image, though, I just wanted to say, like, when you're talking about the immutability of the soul, I'm sort of imagining that as the child at the center, right? Yeah, at the center.
Yes.
And
this God child,
sort of drawn between these two forces. I know Michael is the good angel, but as Kalsched understands him in the treatment of trauma, he's the good angel that's more just associated with the realm of fantasy, sort of the realm of hope, certainly, right? Like he offers a kind of hope, right? But he's also a kind of part of the defensive structure, in that he offers like a fantasy space for the child that feels safe, right? And that's compensatory to the pain of the trauma, right?
Yes.
He's not necessarily apart from that defensive system, but that the child is kind of pulled back and forth between these two these two forces, right? Yeah. So I think you're saying that this child represents the hope of integration at the center.
You said that better than I could. That's a great summary. I think we're done the podcast. No.
Oh God, don't even. I will say, I like to say I have a master's degree in listening, though, so my summary game is on point, right?
That's great.
Yeah. No, but that's
we should
really
all
good.
strive for that. Yeah.
That's really good. Yeah, that's really good. Like this idea of the child, the immutable, the soul. Yeah. That's it. Episode's done. What? Okay. No. Here's my question. Here's another question. So this is like, again, I don't know if you'll have an answer to this, but the question is, what do you think it would mean to include the soul in the treatment of trauma then? Yeah.
Yeah. Well, I think first of all is not being afraid to mention, that we believe that, as a trauma therapist, that there is something that's like a soul or a self, and maybe hearing what the client has to say about this understanding. But is there maybe there's even times in their life of where they felt connected to something greater than themselves, or they were able to overcome, right? I was talking with somebody today about, there was this moment where they were doing art and they kind of transcended, or, they're speaking to a large crowd, and it was like they were out of their body and then they came back into their body, right? So and they were channeling, right? Creativity, they were channeling beauty, they were channeling the truth that people maybe needed to hear or to see. So I love to hear examples of that from clients, but I already kind of gave a definition of the soul. So to actually bring that in, right? Because I think so often we just don't even talk about that, or many therapists don't. And maybe, that's controversial or whatever. No, I'm very open to what clients' interpretations, if that even fits for them. But going beyond that and then understanding, okay, so we lower your symptoms, and then what, right? What is a good life, right? What are your values? Richard Schwartz talks about these 7 C's. I never can remember all 7 C's, but they kind of clarity, connectedness, creativity, right? What would be, living a life in accordance to being self-led, right? Accordance to your values look like, right? These are, I think, elements of positive psychology and meaning-centered psychology, existential psychology in some ways. So that would be adding, I think, the soul, right? Root humanity, right? The things that make us really human and not AI, I guess, or different even then from animals.
Sure.
Yeah,
Well, I've got some.
those are a
I
few
just,
things.
yeah, I got some thoughts on what you're
Please,
saying, Richard.
love
And
it.
maybe a place that I disagree with you. It's not really a
Sure.
disagreement because I don't know that you're really like lauding this, but it's sort of the idea that I don't necessarily think that if trauma treatment is done well, that we need to punctuate the good life for someone, because I think that what happens in trauma is that, again, the kind of the gates of life close and are shut, right? And so the person they're on the other side of the gates and they can't make sense of, they can't sort of, they're disconnected from the flow of life, right? Like
Yes.
they can't feel their
Yes.
way forward into life, right? I think though that if they can be sufficiently supported to open those gates and to feel, to suffer the pain
Yes.
that comes
That's
down that river.
necessary.
Yeah, that's necessary, right? Yeah, and survive it, right? Suffer it and survive it, right?
Yeah.
And feel it. And in surviving it, feel the confidence to open the gates again, that life then flows very naturally. And so that's just my nitpicky contention there, is the idea that if we're robust in our support of the patient's grieving and grief work and their feeling of the pain, right?
I find that often to be the case. Yeah. Because they already have dreams, they have potential, and those conversations will often come up on their own. Sometimes they don't. There is some points, to the triphasic model, of we could take from narrative, we could take from other meaning-centered approaches. But yeah, I think generally I do agree with that. I think why you asked the question earlier, why is it important maybe to believe in the soul or include the soul in treatment? The other reason is because, again, if we're going with this idea that the soul is immutable, there's something that I'm not defined by trauma, that's, pure, innocent, that I need that part to witness myself, I guess, right? As I'm addressing, there's something that allows me to, if I really am connected to my soul, then I can handle almost anything, right? This idea from Viktor Frankl too, right? That if a man has a purpose, a why, then they can withstand almost any how. So this soul element is very important for people to be, okay, I'm going through this and I'm feeling the pain, I'm feeling the somatic sensations. I'm looking at the impact on my life. It, was too much to bear, but realizing, okay, actually, I am stronger than I think. There is this part that's untouched. And also, I think we're modeling that as therapists, right? I'm with you in that experiencing of the pain as you're telling the story or as you're bringing up like these devastating experiences.
Yeah, absolutely. I think that like good trauma treatment just takes us back to a place of vulnerability, not away from it, right? And that it's that space of vulnerability that allows life to really happen too.
Yes.
So I'm just thinking about, we don't want to equate trauma therapy. This is just me speaking to the void, mind you, but we don't want to equate trauma therapy with somehow like strengthening a person beyond vulnerability. And that, I think that's sometimes the fantasy of those who are really traumatized, is they are open to the idea of therapy because they imagine it. I'm speaking about myself here, really. Like they're open to therapy because they imagine it as a vehicle, that will bring them beyond vulnerability, right? And maybe some of those people get really disappointed when therapy is just takes them right back to
damn,
the heart
I'm
of it,
even
right?
more vulnerable than before.
Yeah.
There's actually an increased, I think, sensitization to life and to others.
Yeah.
I've seen in some really good consent forms from some places that I've worked at that really warn clients in a sense of like, your relationships will change, right? If we're doing this well, really, your view of yourself may change. So many things may change, right? So it's not something to be taken lightly, right? It talked about absolutely the benefits of therapy, but I like that it describes some things like there's going to be some hard work and there may be some changes that are difficult, right? This idea of Socrates, right? Of once you have shined the light right into this cave, and people now the cave dweller, right, has escaped from the cave and they're now in the upper world and looking around, they can't unsee. So even if they go back into the cave, they're forever changed. They could describe what's happening in the outside world to the people that are happening in the cave, their former compatriots, and actually might be very alienated from them and disbelieved, right? It can be an alienating process, more connected to oneself, but it can be alienating to others. I have known relationships in my own life definitely to end or to be strained as I've gone into the field longer. The more work that I've done on myself, the more that I'm addressing suffering, really difficult social issues, right? It's almost like, you know, even as therapists, and I talk about this with my students sometimes, is that people working with the most vulnerable, it's almost like, and in India, right, there's this belief too, there's these the untouchable caste, that if you were to associate with the untouchables, that you then are also untouchable, right? And so this, unfortunately, I think can even happen with trauma therapists, social workers, right? Go to a party, describe what you're, oh, I'm a trauma therapist. People are like, oh, that's so, maybe they'll say, oh, well, that's so amazing. What a savior you are, or something. I don't know, right? Or they just walk away right away. And it, yeah. So I just want to say it can be really alienating for the client and even for the therapist to do this work, right? It is a sacred journey not to be embarked upon lightly.
Mm-hmm, mm-hmm. Yeah, like trauma can, like good trauma therapy or trauma work, like grows us, and we can eventually outgrow a relational space that we were in before. Yeah, 100%, 100%. Maybe we want to just touch on the last sort of to wrap up this episode for tonight. I guess just some thoughts for new therapists. I know Richard, like you're a supervisor, and so you want like prompting you right now. You wanted to sort of explore a little bit about things for new therapists. So do you want to start us off around that, and we can talk through that a little bit?
Sure. I think it actually is a good segue of what I just mentioned too, that for therapists to know that if they are going to put their, tile out as a trauma therapist, they've gotten sufficient training, and I think beyond now, hopefully it's clear in this podcast that understanding neurobiology may be a part of it, but that there's a lot more to it, right? So understanding the emotional, spiritual, physical, relational impact of trauma, that they've done their own trauma work, that they have one thing that I will look for in students working with me, especially if students that eventually I'm wanting to mentor or apprentice into potentially doing like co-sitting for psychedelic work or something like that, is or long-term kind of being part of the collective that we have is an ability that they have suffered in some way, and that they have addressed that suffering, and that they are able to maintain kind of a window of tolerance and compassion for themselves and for the client in the face of suffering. So their ability to address suffering and the powerlessness, I should really say, the power to know that there's some times, right? And I respect your work so greatly with BC Cancer. That is a very good example of, we have clients that we know will die, right? They're very, very likely that they will, right? There's not really an escape of that. And this is one of the hardest things for any therapist, but for new therapists in particular, are very often ill-equipped unless they have maybe had someone they have lost in their life and then have done therapeutic and spiritual work around it. Those are often some of the best students and like future colleagues that I've had. Those are a couple of points that come up to mind.
Yeah. I mean, like my sort of reading of, and like, I guess development in the direction of like competency and trauma, it just for me reinforces the idea that like you need to be well versed in psychodynamics, and that means experientially as well, right? To have like worked with or had an experience with in a psychodynamic direction, at least, where it's more than just understanding the facts of your trauma, but the inner impact and how your experience has been structured by it. The
impact of ruptured attachment, but
I think
that
like
even,
I think that there's a lot of integrative modalities that incorporate psychodynamic theory and technique, and that's really, really important. And I'm glad to see that in our, like, in this sort of space of traumatology that we're in now. Like a lot of the integrated modalities that I see out there are geared in that direction, and that's really, really good. And I think I just can't emphasize or punctuate that enough. And if there's ever a place in my mind of the need for and a resurgence around, or then just the need to develop a competency in psychodynamic therapy, it's in the space of trauma treatment, because I just think that it's hard. It's impossible. It's just impossibly hard. Like it's just, yeah, like because like trauma shows up relationally too, and so it shows up, in a complicated fashion. Like it's often not just people being able to go, oh yeah, let me just tell you about my trauma, and
Yeah.
like it, it'll be more like you'll meet a patient and like weird things will happen, or just like
They're wrestling with questions that will totally throw you off.
Yeah.
Right.
Or
among many things.
Yeah. Like you're just like,
Yeah.
just the way they talk about things, or the things they don't talk about. Like, so having a attunement to relational process, like this is my, I just can't emphasize enough like the value of that kind of approach, and trauma just reinforces that. So, and then I think too, like just we wanted to belabor this point because we love to come back to this point, like the risk of interpreting trauma as a deficiency to be filled. This sort of consumer-oriented focus on psychotherapy, just have to throw up our obligatory caution against falling into the trap of psychotherapy as a product, right? Yeah.
Oh, if you only do A, B, C, yes, it's exactly well said. Yeah.
Yeah, just like trauma is not, although it often can be interpreted as, oh, this person is just missing love or connection. Yes. And if they just had those things, then they would be better, right? And we have to go a little bit beyond this idea of like, trauma as just creating a void in a person, because it's not that. I think the image of the gates cutting off the flow of life is more sufficient, right? And that, so it speaks to a different kind of process than just here's something to make you feel better.
I really like this last point I'm just reading here.
Sure, yeah.
We talked a little bit about it. It also means dealing with doing shadow work. You've done shadow work on yourself and with others, and being able to address parts that you would rather not, parts around shame, parts around intense anger. That is part of working with clients that have had a lot of trauma or are stuck in their trauma, coming to you around this. We must practice what we preach. And so, this comes up a lot with students sometimes, right? They get the sense that being trauma informed is, okay, I got to be so sensitive about, the clients, all the intersections, right? Their sexuality, gender orientation, their culture, socioeconomic, all of these things, right? And so it's like anything that I'm going to say, like trigger warning, like I'm going to, re-traumatize my client. And I often have to say to students that having a lot of tentativeness around a client, right, is actually increasing their anxiety, right? It also can give a message to clients sometimes that you don't think that they're strong enough, right? There's absolutely a place for understanding all the different, that's not what I'm arguing, is understanding the different aspects of who a person is, those influences, absolutely, right? But if we avoid certain topics, there's assumption making. That's when the problem happens. I'm going to make these assumptions that because, this person is, a Black person living on Jane and Finch in Toronto and unhoused, that they then, can't handle, right? Trauma processing. They can't handle maybe where they really need to go, where, right? And so clients will sometimes say, well, this therapist, a previous therapist, treated me like a China doll, right? That I was going to break. I was a fragile doll that was going to break. And this made me not want to go back to therapy, right? And one of the good compliments I've received is, Richard, like if you say something, you're very respectful. Like you maybe will give kind of a disclaimer, like, well, I'm not sure if this will fit with you, but you say what you mean, and you've done work on, on yourself, and you are not shying away from the tough questions. And if you're really not sure about something, you ask, right? And that you have confidence that I'm not just my trauma, that I'm not just my symptoms.
Yeah. 100%. 100%. It, like, trauma therapy isn't handling patients or clients with kid gloves. It's not being overly sensitive, for sure, for sure. And Kalsched warns against this. Like, he says that a common dynamic that happens is that the therapist identifies too strongly with the good angel. They identify with the voice of hope. They identify like with the kind of the feminine element, right? They create a really soft landing space because they read the person as vulnerable and as sensitive and as in needing of a kind of support. But in doing so, they don't leave room for the bad angel, right? Like the angel of aggression and destruction, which also needs to come out and be integrated, right? Like a person who is traumatized, especially traumatized in the context of their early development, they actually need the anger of the bad angel. It needs to come out. It needs to be in the session. So there actually needs to be an energy of confrontation in the session in order for that bad angel to be worked with, right, and brought back in.
Yes, we make room. We even welcome anxiety. We welcome anger, right? So that then the light can be turned on them, but we develop a relationship with them to really understand, or, that old saying, what we resist persists.
Yeah, and that actually means, in some ways, being a therapist that's not too nice, that can be confronting, that can be challenging.
Yes.
That can leave a person a little bit, right? And
I used to be way too nice of a therapist.
I am and right there with you.
We're not a rent-a. Yeah, I have to say to trainees too. Yeah, we're not. I had a supervisor that said that we're not a rent-a-friend. That doesn't help our clients, right, to avoid what really does need to be talked about, addressed, or felt, and what a lack of faith that could have in our clients. Right, they've already been through so much, right? They've already survived by the time that they saw that they're seeing us. So have some faith in them.
Mm-hmm. All right. Well, any final thoughts, Richard, as we wrap up this episode on trauma?
No, I think that's great.
Yeah, I think we touched on what we wanted to say. I hope this was valuable to the listeners, that we, if nothing else, just sort of opened the space of traumatology. This certainly wasn't an episode in the spirit of criticizing the really great things that are going on in the space of trauma, and just sort of going back to our beginning and the historical turn and emphasis on trauma. I just want to reiterate again the value that's brought to psychotherapy. I think it's sort of undisputed across our discipline how great it is that trauma is like central to our work with people. And I think its focus is warranted. So it's good. And I just hope that what we talked about tonight sort of added to that and articulated some of the challenges and unique difficulties of working with trauma. So, all right. Well, thanks, Richard.
Thank you, Glenn.
Yeah.
We hope you enjoyed the podcast and are a little wiser for it.
Thanks for listening.